because we know that Americans are not super healthy. We all need some extra support, primarily in the area of sugar handling. Here we go. Okay, so in the topic of sugar handling, I guess most people are familiar with the concept of blood sugar. So in your metabolic panel, there will be a fasting glucose number. So you generally speaking, if that number is somewhere in the 80s, maybe up to about 95 or so, you could kind of think, oh, well, that's kind of okay. But you have to consider that your glucose goes up and down every single time you eat multiple times a day. So your glucose is bottoming out sometime in the middle of the night, and then depending what you eat the next day, then you may or may not have like an insulin spike. So the fasting glucose has been monitored more than any other sugar handling number for years by the medical community, but it's not the most accurate thing because of the fluctuations, and it needs to be put in context. And so these two markers can help you understand if there is maybe an issue with your glucose staying up too long and contributing to your weight gain. So first off, the hemoglobin A1C. This is an average of 3 months of the way that your red blood cells are sort of marinating in your blood sugar. So, if you're getting ready to make a really good steak, you're going to take that meat and you're going to marinate it. And you're probably going to put some kind of a sauce on there that, has some kind of a sugar. And when you cook it, that sugar is going to sort of caramelize into the meat. It's going to sort of tenderize it and flavor it. And there's sort of a similar situation that's happening when you eat sugar, and some of that sticks to the proteins on your red blood cells. So the A1C test is a measurement of the glycation or the stickiness that has resulted from your red blood cells marinating in your blood sugar for an average of about 3 months. So this is a good test because if it starts getting up into the high fives, then you start entering the pre-diabetic zone, and that is a major warning to your medical doctor. But it's not a perfect test. So for a lot of doctors, this is the main test that they're looking at to decide if you're pre-diabetic or if you're already in the diabetic zone, which would be once you get above a number of about 6.4. But it's also not a perfect test. So the test assumes that your red blood cells live for 120 days. But if your red blood cells have a shorter lifespan, then they don't get quite as much time to marinate in your blood sugar. And so that test value is going to be underestimated because the glycation or the thickness won't be as much if the red blood cells are dying off too soon. So let's say if you might have a condition of hemolytic anemia, or if you've had some kind of a situation where you just lost a massive amount of blood, either maybe from a blood donation, or you just delivered a baby, or who knows, maybe you had surgery, or if you've gone through some kind of infection, maybe mono, and you have an enlarged spleen, or if you've had a blood transfusion, or even people with sickle cell disease, or a G6PD gene deficiency, any of those conditions can cause your red blood cells to die off sooner than 120 days, and it might make your A1C measurement inaccurate. On the other hand of the spectrum, if your red blood cells are living longer than 120 days, then you may be overestimating the significance of your A1C. If you have had your spleen removed, if you have iron deficiency anemia, or if you're deficient in folate or B12, those can cause your red blood cells to live longer. And as a result of that, they will be marinating in your blood sugar longer. And so the glycation will be greater and your A1C may get thrown off. So even though A1C is a very important marker, and there are many studies that have gone on over many years that tie it to the risk of developing type 2 diabetes and cardiovascular disease, it also has these caveats where sometimes it may give you a misleading result. So the standard range of what's considered normal would be anything less than 5.7. But most functional practitioners really have a goal of trying to get you to 5.4 or below, because that would represent much healthier blood sugar fluctuations and lower insulin overall. Okay, so let's take a look at fasting insulin. This is also a very affordable marker, and it gives you good information about, am I really insulin resistant or not? So insulin is important because it is a fat storage hormone. And not only is it provoked by the amount of carbohydrates that you're eating, but it's also provoked by fluctuations in cortisol. So cortisol is your stress hormone. And when you're very stressed, even if you're not eating anything, as cortisol rises, insulin will follow. So this is why people who are very, very stressed out, and they're so stressed out that they're not hardly even eating, and maybe they're just sipping on coffee all day and they're just running on fumes, their excess cortisol makes their insulin go up. And from the onslaught of continued high insulin, eventually your cell receptors can become resistant. So this is a wonderful, very accurate, good warning sign of insulin resistance. Because again, it's fluctuating all the time, but when it's high on a fasting basis, when you haven't had anything for 10 to 12 hours, then you know that there's something wrong. Either you had a very high insulin response to something you ate the night before, or your cell receptors, your insulin receptors that live on your cell membranes are not sensitive enough to suck it down overnight. So this is why when we see somebody who's starting to show the signs of prediabetes and insulin resistance, and they've got some stubborn weight gain that they can't get rid of, even though they're working out, then we also start thinking, what's going on with your cell membrane health? Do you have enough omega-3 fatty acids? And do you have enough phospholipids to maintain a good, healthy cell membrane? So that your receptors can pick up that insulin to unlock the door, just like you're using a key to unlock a door, so that you can allow the glucose to come into the cell, and that's how the mitochondria get their fuel to produce their energy. So if you have had very low energy, stubborn weight gain that doesn't go anywhere, we often like to check fasting insulin and see if this is the problem. So on your LabCorp test, you may notice that the upper limit of what they call normal is very high at 24.9. So that would be more of a normal number if you had just had a meal. You can imagine if you've just had, a sandwich, or a bowl of pasta or some kind of carbohydrate like that, your glucose goes up, and then your pancreas has to produce the insulin to bring your glucose down. 24.9 would be normal if you just ate a big bowl of carbs. But if you didn't, if you hadn't eaten anything since dinner the night before, ideally, your goal should be between 2 and 5. And so if you're not there, let's say if maybe you're in that gray zone somewhere between maybe 6 and 10, then we have to consider, is stress playing a part in this? Or is it truly a person who's eating too many carbs? Let me let Travis back in. There we go. So if your fasting insulin is between about 6 to 10, sometimes it can be a little deceiving. It might reflect how much stress you've been under lately. And so that's just sort of a icebreaker kind of question that we would just need to ask. But if it's above 10, then we know definitely carbohydrates are at play, and there's probably a lack of muscle mass in the person because the more muscle mass you have, that gives a place for the carbohydrates to go. All right, so then once you have this information, it might be nice to kind of double check and do what's called a HOMA-IR calculation. So this is where you take your fasting glucose and your fasting insulin, you multiply those two numbers together, and then divide by 405. And so this gives you an idea is there some kind of disconnect between the two numbers? Am I really kind of in trouble or am I sort of borderline? So when you do that little math, you want to make sure that that number, whatever it comes out to be, is less than 2. And if it is, then you're probably good. But if it's not, then potentially there's more you need to do with your diet. Sometimes people have an abnormal insulin response to a normal amount of carbohydrates. Sometimes people really can't handle grapes or bananas, but they can handle apples just fine. So sometimes we have to get a little bit more specific with the types of carbohydrates coming in. So on that note, uric acid is very interesting to run. I like to order this one because through LabCorp, it's only $3. Like it adds nothing to the budget, but potentially it adds a lot more to the discussion. So uric acid is a reflection of the way that your kidneys are handling certain kinds of carbohydrates that are coming in. When uric acid is high, it can be very concerning because that can cause gout. And nobody wants gout. It's very painful. What happens there is that you start forming crystals that settle into your small joints. And it commonly affects the joints in the big toe, but can also affect the ankle and even other areas. But more than that, uric acid is also a risk factor for kidney stones. Nobody wants that kind of pain as well, and other kinds of joint damage throughout the body. So uric acid often goes up when there is excess fructose in the diet. So fructose is a form of fruit sugar, but honestly, I don't really think that anyone is getting sick and provoking their uric acid just from like eating too many strawberries or blueberries. Potentially, you could get yourself in trouble from eating too much honey. Honey is pretty high in fructose, but for the majority of Americans, it's actually the high fructose corn syrup that, we probably eat it every day. Like even if you're a healthy person, reasonably trying to watch out for your health. High fructose corn syrup is in, all the regular sodas. It's in regular ketchup. It's in lots of sauces, especially barbecue sauces. So I have a challenge for you guys. The next time you go to the grocery store, take a look in the barbecue sauce aisle and see if you can find more than one brand that does not have high fructose corn syrup in it. If you can find one that's made with cane sugar, like glory to you. Like good job, because it's really hard to find. Also, uric acid can go up when you have too many purines in your diet, which would come from red meat, like steak, and also shellfish, like especially shrimp, and also wine, beer, or anything that has a lot of sugar. So it could even be your Starbucks Frappuccino, something like that. So uric acid is important because it's an underlying cause of cardiovascular disease. And what happens is not only can it cause crystals that settle into the joints, but it can also damage the endothelial cells, which are involved in pretty much every inflammatory disease process. So endothelial cells are so important that I wrote a blog that's on our website. It's called endothelial stress or something like that. Endothelial inflammation and cardiac stress, I think is what it's called. So you can find that on drbobbacon.com. And it just goes into more detail about all of the different parts of your body that and the symptoms that you can have in your microcirculation when your uric acid is high and when the inner lining of your arteries and capillaries are being damaged. So when you run this test, it's ideal to be somewhere around maybe 3 or 4, but up to 5.5 or so is pretty normal too. So the lower the better with uric acid. Okay, so then let's take a look at C-reactive protein. So this has been a marker of systemic inflammation and risk for cardiovascular disease for many years. So all the medical professionals obviously are familiar with it. They just don't often run it. And I don't really know why, because it's very useful and it's not expensive. The issue is that sometimes when they do run it, they get the low sensitivity test where the normal range is anywhere from 0 to 10. And it's a lot more accurate to get the high sensitivity one. And in our network, it's only a $2 difference. So like I said, C-reactive protein is a measurement of systemic non-specific inflammation, which could be prolonged. It could represent like chronic inflammation, maybe a long-term sickness or, long-term sugar handling issues, but it could also be temporary. So sometimes C-reactive protein goes up when a woman is pregnant. It could be temporary because you just had some kind of a virus that set your body on fire for a little bit. You could even have high C-reactive protein if you've been overtraining and you just went through a track meet or something, or you just ran a marathon and you have a lot of tissue damage. So C-reactive protein, it is very helpful, but it's also sort of non-specific. The goal there, if you've got the high sensitivity test, they say the normal range is, from 0 to 3. Ideally, you want it as low as possible. Less than 1.5 is really good. Okay, and so homocysteine. Have you guys heard of homocysteine? Yes. Yes.
Yes.
Okay, good. In our personalized consults, when I talk to people and I mention homocysteine, like 9 times out of 10, nobody's heard of it. And it's such an important marker. It really kind of breaks my heart that people don't know about this one yet. I think a lot of people maybe have heard of the MTHFR genetic mutation, but maybe they don't really know what that means and they've never done genetic testing. And so they don't really know like if it applies to them. But 40 to 60% of the population, somewhere in there, have genetic markers that diminish your capacity to perform methylation. So methylation is one of the processes that the liver does in order to remove toxins from the body. So that's involved in getting rid of the toxins that we breathe, the toxins that are in our food, and also the metabolic toxins that we have just from living normal life, including our hormones. So all of our hormones and all of this metabolic waste and things that we produce, especially from working out, like everything has to be neutralized and detoxified and flushed out of the body. So methylation is one of the ways that our liver deals with that. And of course, it uses these nutritional factors, mainly B vitamins, in order to run this process. So homocysteine is a protein. I guess it's an amino acid that builds up in the bloodstream when you're not methylating properly. So if you potentially have deficiencies in certain B vitamins that are listed here, B9, B12, B6, B2, that's riboflavin, SAMe, and then maybe if you're not eating enough beets to get the betaine out of it, or methionine, especially if you have these genetic markers. If your methylation is not working well, homocysteine builds up and it's very inflammatory. So homocysteine potentially can make your cholesterol level rise. It can make your C-reactive protein go up. It can inflame your blood vessels where, maybe you're bruising easily. It could be part of that. Maybe you're getting nosebleeds frequently because your blood vessels are weak. It could be potentially a risk factor for stroke. So that's, basically the problem with homocysteine is it weakens your blood vessels. Nobody wants weak blood vessels. It's a higher risk factor for cognitive decline, dementia, stroke, cardiovascular disease, all the things that you don't want, basically. So this is a very important marker. And in our network to order this and to tack it onto a regular blood work order, it's like $20. And you get so much information from knowing that and then also tracking it. So this is an indicator that lets you know, am I eating enough beets, enough dark leafy greens, and getting enough B vitamins either in my diet or through my supplementation to keep my inflammation levels low. So one of my favorites to track. Okay, so then these two markers here are also very interesting, especially if you have high cholesterol. Most everybody has seen their basic cholesterol panel, the total cholesterol, the HDL, the LDL, the VLDL, and the triglycerides. If you have a problem there, and it seems to be kind of chronic that, oh, my total cholesterol is always high, or my LDLs are always high, well, that's really just a light on the dashboard that you probably need to look further. So lipoprotein A, this is one that gives you an indication of your genetic risk for cardiovascular disease. This is a marker that you can't do a whole lot about. It's not expensive to check this, but when it's high, I feel like it's kind of unnerving for people to see, like, oh no, I've got an abnormal marker that's flagged. Well, it's mostly genetic. If you change up your diet and your lifestyle and you reduce your inflammation, maybe you can get this to come down maybe about 20% or so. It's just not quite as modifiable as some of the other things that we've mentioned. Like you're just not going to see as big of a swing. But it is helpful to understand, like if your mom or your dad or your grandparents or your aunts and uncles, like if everybody is having some kind of cardiovascular issue, then yeah, probably the LPA is maybe a little high. So it is good to see that, but you don't need to test this number repeatedly every time you're redoing your labs every year. You can check it one time and you can kind of see like, oh, yeah, that's kind of high. Yeah, we have a lot of cardiovascular risk in my family. And that's about it. Good to know. ApoB, on the other hand, is turning out to be a very useful marker because you can modify this with what you're doing in your daily life. You may see that your ApoB is very high once you get back from vacation because you've had a whole lot of sugar, a whole lot of alcohol, and you haven't had enough omega-3 fatty acids. So what this number is, it reflects how much of the dangerous atherogenic particles you have within your cholesterol profile. So it's taking a look specifically at the LDLs, your low density lipoprotein, and it's like a count of the particles that potentially could cause problems and would be more prone to plaquing and clotting. So those are the major problems that you have, so you don't just want to look at your regular LDL in the basic profile. It's totally possible to have the big bouncy beach ball LDL particles that are not dangerous. So in your basic profile, I hope this is not confusing, but you may have LDLs that are high, but not dangerous. Or you may have LDLs that are high and they are dangerous. And so the ApoB test is one way that you can get and understanding, do I have the dangerous kind of LDL particles or not? Is it something to worry about where maybe I should consider taking a statin and talk to my doctor about risk-benefit analysis, or maybe do I just actually need to tighten up my diet, get a little bit more fiber, get better about taking my omega-3s, and then monitor ApoB to make sure that I'm doing a good job with that. So the functional goal here should be maybe less than 80 milligrams per deciliter. And in my opinion, this is one of the best markers that you can watch to take action on and know that you're doing something well. Okay, so another thing that you can do if you tend to have lipid profiles that are kind of off would be what's called the NMR lipoprotein analysis. This is a detailed cholesterol analysis. This is what they call it at LabCorp, the NMR. At Quest, I think they call it Cardio IQ. So it's about $50 to tack this on to a regular lab order, and it gives you more detailed information. So here they're measuring the size of the HDLs and the size of the LDLs and how many of the small, dense LDLs you have that are the most dangerous. So it's just another way of measuring what I just mentioned to you about the ApoB. It's just a little bit more expensive than looking at that marker. So I like to take a look at them both and make sure that all the information is jiving when we're trying to understand somebody's risk. Okay, and then oxidized LDL. So if you can imagine your cholesterol, that your cholesterol and your lipids that are floating around in your bloodstream, if you can imagine that some of those might be fresh and shiny and in really good condition, slick on the outside and just slipping through your bloodstream easily, like kids going down a slip and slide, that would be a really good ideal situation. If you can imagine those cholesterol particles rusting on their outer edges so that maybe there's a little more friction when the lipids are moving through your arteries, potentially bumping into the sides and causing damage as they move, that's a much worse situation. So that's kind of what's happening with this measurement called oxidized LDL. This one is a little pricey and it often doesn't fit in the budget. But if I've been looking at labs with people and I do have some concern, and I don't really want to see a lot of the same old markers like anymore, then I'll make some room in the testing budget for oxidized LDL. So this can be a reflection of maybe being exposed to too many EMFs, electromagnetic frequency. It can be a reflection of too many restaurant oils, like, going out to restaurants and eating too many seed oils. It can be a reflection of too much sugar in the diet, or maybe having mold in your house, like having mycotoxins, or any other thing that really can cause a lot of inflammation in the body. It could reflect heavy metals that you're exposed to either through your job or, I don't know, people don't really have lead paint in their houses anymore, but it could reflect maybe microbiome dysbiosis. Let's say if you're overrun with yeast and fungus or parasites and they're giving off their metabolic waste and that's causing inflammation in your body. So this is, again, a non-specific marker of inflammation, but if the oxidized LDL is high, it's actually pretty serious because it shows that your cholesterol profiles are kind of rusting from the inside out. Now, I have seen two of our clients who really did an impressive job, who they got this test done, they saw that their markers were really high, and they immediately doubled up on their fish oil, started eating more fish, like sardines, herring, mackerel, did everything they could to figure out what's going on in the home, eliminated scented candles, eliminated Glade plugins, and just started being more intentional with their diet and their exercise. And then we reran this test. So this one particular guy I'm thinking of, his oxidized LDL was very high. I feel like it was like 400 or 600. And the next time we ran it, it was below 200. So he was feeling much better, like he was on the right track. And then recently we just reran it again, and his measurement was less than 6. So, I mean, this is a real life client, he's not perfect, but he put some special attention where the attention was needed, and he got a really good result. So, was proud of him for that. Okay, so big picture, metabolic disease shows up for people in, I've got all this weight that I can't lose, belly weight for men, thighs and buttock and belly weight for women. And usually people are eating too many refined carbs and sugar. Sometimes it's also hormonal, and that top hormone that stores fat is insulin. So hormones are not a mystery. We just have to know what are the things that are probably playing into what you're feeling, what are your symptoms, and then we should test them. And we should check and see if the assumptions that we're making actually make sense, like in black and white. These things are not expensive. It just takes a little bit of a thought process to make sure we're ordering things appropriately. So address the carbs in the diet, address the workouts, make sure you're working on building muscle, make sure your insulin is kept under control, and any sources of inflammation are also managed. For somebody who has familial risk factors, everything that I talked about today, those are things that we should monitor from time to time to make sure that nothing is really getting way off track. Because the end result, if you're not watching out for these things, could be buildup of plaque, having blocked arteries, and having some really serious cardiovascular events. Nobody wants that. So overall, no single lab tells the entire story, but when you can put them together in context, these markers provide a much more complete view of metabolic health than just a standard lipid panel by itself. And that is that. That is all I've got for you today. So if you guys had any other comments on that, I would love to hear from you.
No, it was really good. I had to step away for a second. Someone walked in to get adjusted, but um, yeah, just going a little bit more in depth, kind of just like what we have been the last few Zoom calls, just more to the blood work than the what you normally get when you go to the doctor. So sometimes there's a little bit more to what's actually going on and how that relates to what you may be experiencing.
Yeah,
Yeah,
awesome job, Claire. I know some of the analogies that you used. I gotta start using those when I'm talking to people about it when they have questions. So that definitely better way of explaining it than maybe I have been. So
right.
yeah,
Because, sometimes like we know what we're trying to say, and we know these things are very important. We're trying to convey that to the person, and they're just like, just nodding, just kind of
hmm
staring, but like it's not really computing. I mean, I feel
yeah,
like if you can, put it together in some kind of analogy, then maybe they get it a little bit easier.
yeah,
So, I mean, that's really the heart of what we're trying to do for people, is to get them to feel like they understand their lab tests, they understand what they're feeling in their bodies, and then they also understand how to take practical next steps to make everything better. So that's the challenge.
yeah. Awesome.
Great. Okay. Well,
Awesome.
we will have more of these, little webinars coming up. I think the next one that we're going to be doing is going to be all about thyroid hormone conversion. from T4 to T3. So that'll be exciting. And I know we're also going to have other blood sugar oriented videos because this is such an important topic. All right.
Yep, and we'll get an email sent out probably the week of or the week before, and so everyone can have a chance to join if they choose to, but if not, we'll post it on the program.
Yeah, so for everyone who's in our membership program, of course, they always have access to these Zoom recordings. So, and along with that, they also have access to our Health A to Z library, where we have actually uploaded probably 40 handouts that were not there just 2 weeks ago. And so we have a lot of recipes and explanations and supplements to consider. And basically just it's a whole library of our nutritional strategy for different kinds of health topics. So for anybody watching this who's in our membership program, Living the Dream Daily, that's where you look. And if anyone has trouble getting through that because it is so much info and it's such a rich resource, then just let us know through email or phone and we'll help you out with that. Okay, so that's it for today. Thanks very
Awesome.
much, guys. See y'all in the next one.
You stopped the recording, Claire?
I'm trying.
Uh,
I'm trying. We'll have it recording. Stop.